Today's webinar. Thank you very much for joining us. For those of you who are new to Carers Wales, we're part of Carers UK nationally, a membership charity of unpaid carers, which was established over 55 years ago. In that time, we've campaigned and fought hard for the support and rights to make life better for those who are caring for someone. And the three main areas of our work are policy and influencing, campaigning, information and advice services, and innovations to support carers, including those who are working carers. So during this webinar, we're going to be giving you an overview of Carers Wales's work in supporting working carers. We define a working carer as someone who provides unpaid support and/or care to one or more people because they're older, ill, vulnerable, or have a disability, whilst also maintaining full or part-time employment. Carers may provide care on a temporary or a permanent basis, and caring can include physical, practical, emotional, and mental health support. Supporting working carers is a key priority for Carers Wales in furthering our mission to make life better for unpaid carers. As part of Carers UK nationally, carers and employment has been a core stream of work dating back to the 1990s. Our primary objective has been to ensure that carers are able to maintain employment for as long as possible, whilst also working with employers to look at the business benefits of supporting carers and seeking out good practice where we find it. We work with colleagues across Europe and internationally to understand their policies for supporting working carers. And we use this evidence in our research and our lobbying work with governments, policymakers, and service providers. So against a backdrop where demographic and other factors are contributing to an increasing proportion of the workforce taking on caring responsibilities, our research has shown that if unsupported, caring for as little as 5 hours a week can impact on a carer's ability to work, with those caring for 10 hours experiencing a significant effect. In 2019, a Carers UK survey found that among carers continuing to work the same hours, 1 in 6 said their job had been negatively affected by caring. That include increased levels of stress and tiredness. So the consequences of not addressing support for carers at work negatively impacts both the employee and the employer. We also know from our own Carers Wales Track the Act research that supporting working carers is vital because they are the group least likely to see information and advice, often missing out on support which could really support them in their caring role. We also have evidence from our Employers for Carers scheme established in 2009 that when carers are supported by their employers, they are better able to juggle work and caring. If carers are not supported, they are absolutely more likely to experience stress, have to reduce working hours, miss out on opportunities for professional development, or even leave the workplace altogether. Obviously, the COVID-19 pandemic has had a huge impact, and there's been a significant increase in the number of carers balancing work and care. So it's even more critical now that we support working carers. So during this webinar today, Jake Smith, our Carers Wales Policy Officer, will be giving an overview of the policy context for working carers, and he will be outlining some of Carers Wales's key policy asks related to working carers. I'll then ask our Wales Hub Manager for Employers for Carers, Jane Healy, to give an overview of support that Carers Wales provides to employers and working carers across Wales. I'll then give an overview of our new Welsh Government funded stream of work supporting working carers. In the meantime, I encourage you to use the Q&A button at the bottom of your screen during the webinar to both raise any questions you would like posed at the end of the presentations, but also please do use it as an opportunity to feedback your thoughts to the Carers Wales team as we go through the webinar. Before I hand over to Jake, I just want to let you know that we will be sending out further information via email to all the webinar participants today. And that will include the Carers Wales Working Carers Policy Briefing, which we're launching today, and also further information on the initiatives that we have in place to support employers and working carers. So without further ado, let's get started, and I'd like to hand over to Jake for the policy overview. Thanks, Jake.
Thank you, Claire, and Bore da bawb, and good morning, everyone. I'm Jake Smith, the Policy Officer at Carers Wales. Today I'm going to be presenting to you on the policy context around working carers, the research that demonstrates why working carers must be a national priority, and our recommendations to make Wales a fairer working nation for working carers. In 2019, 1 in 7 of the UK workforce were working carers, equating to around 223,000 workers in Wales. This number has only increased as a result of the COVID-19 pandemic, with 1 in 10 workers across the UK becoming unpaid carers for the first time. This means that around 1 in 4 or 1 in 5 workers in the UK are working carers, juggling employment and unpaid caring. The numbers of working carers have been increasing for many years due to demographic trends. People are living for longer with illness and disability, retirement ages are getting later, and cuts to public sector, community and support services mean that more people are having to take on caring roles alongside employment. In Wales, you have a 50-50 chance of becoming an unpaid carer by the age of 45, but 42 if you're a woman, many, many years before retirement age. Research by Sheffield University in 2010 found that 44% of working carers struggle to balance their employment with their caring role. 30% of working carers have had to reduce their hours because of their caring role, and 36% have had to pass up the offer of employment or a promotion because of their caring role. And in Wales, 75,000 working carers have had to reduce their hours just to make it a bit more manageable. A Carers UK survey found that 40% of working carers who had had to leave employment or reduce their hours are between £10,000 and £20,000 worse off. This can have serious impacts for their retirement income, and if they seek to re-enter employment in their 50s or 60s after a period out for caring, that can be particularly difficult. The cost of carers leaving the workforce has been estimated by Age UK to be £5.3 billion a year, considering lost tax revenues, lost earnings, and other welfare payments. This demonstrates the imperative to the economy and to the public finances of supporting working carers. Though employment law is an area that's reserved to the UK government, we have seen an increasing willingness from the Welsh government to take measures to improve the world of work, and even some to support working carers. The landmark Social Services and Wellbeing Act 2014 said that local authorities have to consider whether an unpaid carer works or wishes to work when conducting needs assessments. In 2018, the Welsh Government established a Fair Work Commission to investigate how to improve the world of work in Wales. The Welsh Government accepted its core recommendation that promoting fair work should be the responsibility of all ministers and officials, and they defined fair work as supporting inclusive employment practices and strong worker voice. Last year, the Welsh Government launched its proposed National Action Plan for Unpaid Carers, which proposed an additional 4th priority for unpaid carers, that of supporting access to education and employment, suggesting this could remain a priority for years to come. Research released by Carers UK in November 2020 showed that unpaid carers have saved the Welsh NHS and other statutory services £33 million every single day of the coronavirus pandemic. This shows that without real support for working carers in Wales, the health and social care system in Wales would only be under huge additional strain. Flexible working helps carers manage both their employment and their caring responsibilities. But a 2016 survey by the Equality and Human Rights Commission found that Wales lags behind England and Scotland in flexible working, with 10% of employers in Wales not offering flexible working, compared to only 4% in England and 3% in Scotland. The Welsh Government has set out its aspiration that 30% of the workforce should be working remotely regularly over the longer term. But analysis by Cardiff University last year showed that Wales has the lowest proportion of jobs in the UK that can be done from home. That's why we're calling for more action from the Welsh Government to promote flexible working. And we also want to see real consideration of unpaid carers in their work to achieve 30% of people working from home regularly. Working carers will often frequently use up their annual leave, for example, to attend appointments or look after the fluctuating needs of the person they care for. And this can leave them suffering burnout and without any time for themselves. Existing emergency leave provisions are often inadequate because they're generally short-term and for unexpected occurrences. A Carers UK survey found that of carers who had left employment or had had to reduce their hours, 40% said having paid carers leave would have helped them to stay in employment, and 50% said having paid carers leave would have helped them to re-enter the workforce. Last year, the UK government launched a consultation on introducing a new entitlement to 5 days unpaid leave for working carers. Whilst that would be an improvement, we're calling on the Welsh Government to lobby the UK government to increase that to 10 days paid carers leave and an entitlement to 6 months unpaid carers leave. We'd like to see the Welsh Government encourage employers in Wales to introduce paid carers leave. And if the Welsh Government is serious about creating a fair work nation, we'd like to see paid carers leave required as a condition of seeking Welsh public contracts. Carers' passports are useful ways for carers to document the flexibility they need in the workplace and the support that their employer will provide them with. But such schemes are only truly effective when they have wide buy-in from across the organisation and can demonstrate that they're matched with meaningful support. And introducing schemes such as the Carer Passport are useful opportunities to create workplace carers policies that bring together all of this support. That's why we're calling on the Welsh Government to encourage employers to co-create carers policies in the workplace with carer representatives. We'd like the Welsh Government to encourage employers to train line managers in carer awareness. In the Fair Work Commission's report, they recommended a series of Fair Work forums at a national level to bring together stakeholders in numerous sectors to work together to improve employment conditions. That's why we're calling for a national cross-sector Fair Work Forum for working carers that could share experiences and work together across sectors to improve the employment experience of working carers at a national level. After this presentation, we'll be emailing you a copy of our Working Carers Policy Briefing that we're launching today. It contains additional research, further analysis, and our full recommendations to make Wales a fairer working nation for working carers. I've put my contact details up on the screen, and if you'd like to talk to us about our policy work around working carers, we'd love to hear from you. Thank you all very much for listening, and I'll now pass you over to my colleague, Jane.
Thank you very much, Jake. It's a real pleasure to be here with you today. I'm Jane Healy, the Employees for Carers Hub Manager in Wales, and I'm delighted to talk about the resources available to support Welsh employers, line managers and the working carers in your workforce, and why that's so important. So, our reports in 2019 identified that there were 223,000 carers in Wales. And as Jake has said, at that point, 1 in 7 carers were juggling work and care. Without the right support, a significant number of those carers will have to give up work or reduce their working hours to care. And we know that since the pandemic, that number has risen. And we are now looking at 1 in 4 in the workplace juggling work and care. So that's 25% of the workforce in your organisation. Sadly, it is the case that most of us will be a carer or need care at some point in our lives. And as our population ages and lives longer with illness and disability, more and more of a company's best employees will be affected by caring. In fact, since our report, Caring Behind Closed Doors last year, 22% of Welsh carers have given up work or significantly reduced their hours to care. Some of the information that we've gathered from the Welsh workforce have said that 25% of carers don't feel able to talk to their managers about their caring role. And the top 3 practices the Welsh public would like to see are an understanding employer, the ability to ask for flexible working, and as you know, we are campaigning to recognise the call for paid carers leave. Every day, 6,000 people become a carer. In fact, most of us don't expect to be a carer, but 2 out of 3 of us will become a carer at some stage in our lives. In Wales, the likelihood of becoming a carer, as Jake highlighted, that likelihood is higher and at a much younger age. And in Wales, you're more likely to experience poverty. By the age of 45, there is a 50-50 chance you will become a carer. And shockingly, you are more likely to become a carer than a homeowner. Currently, 600 carers leave work every day, a figure which is not sustainable given the challenges to workplace and UK productivity. We are facing a perfect storm of pressures on work and pressures on care. And as Claire said, carers are those that look after loved ones who are disabled or seriously ill, and caring can affect anyone at any age, at any time. It can last a lifetime, it can be through a crisis, or it could creep up gradually. And we know it takes an average of 2 years for someone to recognise themselves as a carer. And very few who do self-identify will know where to go for information and support. The prime age for employees to become carers is between 45 and 64, just at a time when you are at your most experienced in work. And with the population ageing and the average age of becoming a parent rising, it brings the additional problem of sandwich caring for elderly parents while caring for children. So the Wales Hub of Employees for Carers is an innovative and growing service for employers. Informed by business and supported by the specialist knowledge of Carers Wales, its key purpose is to provide practical, hands-on help to employers to support the carers in the workforce. Launched in 2009 as an employees membership forum, Employees for Carers now has over 220 member organisations representing around 3.5 million employees across the public, private and not-for-profit sectors. In 2018, the Wales Hub of Employees for Carers was launched to reflect the difference in legislation in the nation. All of the support available through Employees for Carers is available in English and Welsh, and with the additional support of the Carers Wales office, we are now reaching 100,000 working carers in Wales. Many organisations across Wales have recognised the importance of supporting their employees who are balancing work and care through the paid membership to the expert resources available. Resources such as our Employees for Carers digital platform aimed at line managers and working carers, and our digital resource for carers aimed at working carers. And other organisations have invested in gaining carer confidence accreditation. All of these resources help create a workplace culture of support and future-proof an organisation's policies and invest in working carers. So it's really a perfect package for employers to support their working carers and line managers. So how do we help? How do Carers Wales and Employees for Carers Wales help? Well, we help in preparation, creating a climate where it's okay to talk about caring. And this then in turn helps carers to identify themselves. We help with policies, reviewing existing policies that are already in place, and help them to develop to include caring and caring policies, and developing a specific carers policy. We help with practice, and we share tips, templates and case studies from many other employers and organisations, signposting staff to external help with caring and internal help within an organisation. We help with setting up Workplace Carers Network, where we know it's so vital for carers that are working to have peer-to-peer support. And we help with promotion, help the organisation raise awareness of activities, for example, around Carers Week in June and Carers Rights Day in November. And we also help an organisation identify champions and role models, and vitally training and e-learning for managers and staff on carer awareness. We know that there are many benefits for an organisation to support working carers. We know carers feel that they have enhanced self-esteem, loyalty and responsibility when they are supported in the workplace. It provides a better workplace environment and engagement. And the carers that come to work with a carer confident organisation have peace of mind, happier at home and work. And we also know that for employees, stress-related absence has been reduced through by 26%. And it's so important to retain carers through those special leave arrangements, and it represents savings through additional recruitment costs. So when you become a member of Employees for Carers, what do you get and what resources are available for you to utilise within your organisation? Well, the Employees for Carers digital platform is aimed at line managers and working carers and is available in English and Welsh. You get access to our digital platform, which is packed full of information and guides, best practices, templates to support carers policies, carers passports, and sample policies and case studies. You have an initial consultation session where we can work with you and help identify where we can best build upon your existing employee support. We provide training, in-house sessions, all tailored to your own individual requirements, focused on looking at how we can support the line managers, how we can support the organisation to become carer friendly, and really importantly, raising the care awareness within that organisation. You also get access to network events, and as a Welsh member, you will have the benefit of the national events as well. In 2021, we are running an event every single month with topics ranging from supporting working carers, supporting frontline workers, where we know flexibility is an issue. And we also run an event in the middle of the year that is specifically looking at identifying carers in the workplace. As well as that, becoming a member of Employees for Carers, you will get a discounted carer confident assessment. It is the only UK benchmarking scheme, and I will touch on that in more detail shortly. On top of all of that and the many other benefits you get from becoming a member, we will be able to provide you with promotional materials, all tailored to your organisation and with corporate branding. So we're just going to take a quick look at the digital platform, and this is what the Employees for Carers digital platform looks like. It can be co-branded, and as you can see, it really makes sense to support working carers. It has been a vital source of support during the pandemic, where carers working in a workplace have been able to get the most up-to-date COVID-19 vaccination information. It's, as I said, it's packed full of guides. We have an employee's guide, a manager's handbook, and a carer's guide. It's all kept up to date, and as I've said, it's available in English and Welsh. As well as that, on the digital platform, you will also get e-learning, law, toolkits and policies. And the brilliant e-learning resources will help carers identify themselves or others at work and will help them learn how and where to get support. It will also help line managers or other teams with employee wellbeing responsibilities to understand what carers may need in the workplace and how best to support them. You can include the staff induction e-learning in your onboarding process. So you are really encouraging the carer culture in the organisation from day one. So in the law, toolkits and policies, not only is there a compelling business case for supporting carers in your workforce, but there is also legislation to make sure that it happens. And we keep that up to date so you're abreast of everything that you need to know. In the employee toolkit section, there's some really, really important toolkits in there, ranging from topics such as developing a carer's policy, having an employee survey, starting the care conversation with individuals, managing bereavement and managing that conversation within the workplace, and a carer's passport toolkit. In the good practice section, the section has been developed to help illustrate some of the policies and practices that we as employees for carers have identified as beneficial for working carers and have found useful in our own organisation. So that's the Employee for Carers membership. We also have something called the Digital Resource for Carers, and the Digital Resource for Carers combines Carers UK's digital products and online resources with your own workforce information, and it can help you, it can support you to deliver a comprehensive one-stop shop solution for all of the staff that you have in your organisation that may be balancing work and care. We can joint brand the digital resource webpage and bring in all your elements together seamlessly so carers do not have to waste time searching for the internet for support, or worse, not find what they need and struggle on. Digital Resource for Carers includes e-learning, access to Jointly, our care coordination app, information and support on health and wellbeing when we know it's so important for carers to look after themselves, carers' rights, financial planning for a carer, and lots of information about juggling and work and care. You can add your own links to the page and enable carers to access your key workplace information, such as your carers policy, your carers network information, or any employee assistance program you may have. And we provide you with supporting documents, posters and a business card and a rollout toolkit to really get the care conversation going in your organisation. I mentioned our Jointly app, and this is a real benefit for working carers, in fact, any carers out there. The Jointly app is Carers Wales' mobile and online app designed to help carers share and co-coordinate care. Jointly works by enabling carers to set up a circle of care around the person they care for. Carers can then invite others involved in providing that care, whether that's family, friends, neighbours or professionals, so everyone is kept in the loop. Jointly, again, is available in English and Welsh, and it is available for carers to purchase directly. However, forward-thinking employers are subscribing either as part of the digital resources for carers or to Jointly separately so that they can provide and offer the app entirely free of charge to carers in their workforce. Jointly offers a central place to share and store information. It has group communication, so as I said, to keep everyone connected. It has a shared calendar and task list, notes, and really importantly, a medication manager on there. It makes communication and coordination between the people who share care as easy as a text message. It has been evaluated by carers, and they have reported that it absolutely reduces the stress of juggling all of the tasks they have to do in a day. So I mentioned Carer Confidence, our accreditation benchmarking scheme. It was commissioned by the Department of Health in 2017 to develop and pilot an employee recognition benchmarking scheme. There is no other specific UK-wide recognition scheme in the UK for carer-friendly employers. There are other schemes, but they are broader and do not solely look at caring. The Carer Confidence Scheme supports employers to build a positive and inclusive workplace for staff who are or will become carers, and to make the most of the talents that carers bring to the workplace. Carer Confidence seeks to recognise employers who achieve this and inspire others to follow suit. It will help employees understand any performance gaps and address areas for improvement. It's a really extremely robust benchmarking scheme, and a carer or a carer representative is required to sign a section of the application form on their caring experience. So it's a really good opportunity for the employer and the applicant and the carer to engage and discuss internal support. We see the benchmarking scheme as progressive, where an organisation will start at level 1 and move up when they feel ready. However, we recognise that some employees will have supported carers for longer and may wish to apply for level 2 or level 3. There are 3 levels, as I've said: active, accomplished and ambassador, and each measured across the 5 criteria you see on the screen, which is preparation, how you're enabling carers; policy and guidance, how you're making your support transparent; practical support; peer support, and how you're connecting and engaging your carers and promoting that support and raising the awareness. So the cost of not supporting working carers. As Jade mentioned, the demographic, the number of working carers will increase as population ages and people live longer with disability. Retaining working carers in the workplace provides additional savings for a business, as to recruit and retrain a new employer on average is the same cost as a year's annual wage of that role. And carers, if unsupported, are working below their potential, reducing hours or giving up opportunities for promotion. And carers are twice as likely to suffer from stress if unsupported. And it's the key reasons carers give up work and reduce hours. So not only is it the right thing to do to support working carers, but it also makes good business sense. Thank you.
Thanks, Jane. Okay, I'll now give a quick overview of our working carers. Okay, hopefully everybody can see that. So this new area of support has been established through Carers Wales's Sustainable Social Services funding through Welsh Government. And as such, as the support that is available through this work is free. There are 3 main elements of the work: support for working carers themselves, support for women carers to progress at or return to work, and thirdly, promoting social enterprise opportunities. And I'm just going to say a little bit about each of those elements. So in terms of support for working carers, we're in the process of finalising a guide on balancing work and care, which will be launched in the next couple of months. This is a really comprehensive guide, which will include a wide range of very practical information and tips, both from carers themselves and for carers, about how to manage their work and care on a day-to-day basis. This will include things like how to speak to your boss about your caring role and applying for flexible working hours. As I said, it's very comprehensive. We've interviewed and spoken to many carers, working carers, to collate information which we feel will be helpful for other working carers in terms of balancing work and care. The second area is our volunteer and support team will be creating more support for workplace champions and those who are interested in setting up a carer network within their workplace. And we'll be providing information, advice and support to people wishing to do either of those things. And then finally, we'll be hosting some carer awareness in the workplace training. And this will include things like gaining a clear understanding of what a carer is, why it's important in the workplace to understand who are carers, appreciating the unique challenges and barriers that carers face within the workplace, what can be done to identify and then support carers, and then what carers' legal rights are in the workplace. The second area of work is supporting women carers. So Welsh Government research shows that women are less likely than men to be in good quality employment. And Carers UK analysis shows that women are more likely to care at working age than men, who are more likely to care in later life. I think as well, there's still an assumption that women will take on most of the care responsibilities. Added to this, 22% of carers live in poverty, and this compares to a national figure of 16%. And naturally, this is exacerbated by carers needing to reduce hours, not able to progress at work or give up work altogether. So we are delighted to be working in partnership with Chwarae Teg on this, who, as you will know, have been working since 1992 to ensure that women in Wales can enter the workplace, develop their skills and build rewarding careers. So they will be delivering a series of workshops and seminars for working carers. These will be mostly monthly bespoke virtual workshops and webinars designed to help women carers improve their confidence to both re-enter and progress within the workplace. And it includes things like changing your thinking to get results, CV writing, and how to prepare for an interview after caring. The sessions will be starting tomorrow, as it happens, and will be running for the next 2 years. And there's more information about how to book on our website. I think it's worth saying that it's important for carers who may be considering working alongside their caring role or wanting to enter employment because care responsibilities may have changed or ceased. But whatever the stage of the caring journey, the sessions are designed to provide carers with specific support and skills to help them achieve their employment goals. The third area of work is cooperative and social enterprise promotion. So already during this year, we've started working with carers across Wales to gather information and investigate the sorts of services they want to need. The opportunities there may be to setting up community cooperatives and social enterprises and how we can support them to take forward those ideas. We're really pleased to be working with the Wales Co-op Centre in delivering this element of the work. And as you'll know, Wales Co-op Centre is the UK's largest cooperative development agency, providing business support for social businesses and co-ops, including social care co-ops, housing co-ops, and community-owned facilities. So we'll be working alongside Wales Co-op Centre to promote social enterprise opportunities to unpaid carers. And this includes producing an introductory guide with information about the potential opportunities of setting up social enterprises and community co-ops. I'm really pleased to say that this will be launched very soon, as we're also just finalising this guide. Then over the next 2 years, we will be holding events for carers on this work and hoping to identify those who may be interested in establishing their own social enterprise and community co-op, and working alongside Wales Co-op Centre to support carers through that process. Okay, so that's the end of the presentations.